And I never kind of looked at my smoking. It was just something that I did. So I find the smoking diary is really useful as the next step after the cost of smoking wheel.
Thanks,
Both
Serena.
good resources, yeah.
Yeah. I'm just letting people know I'm recording the meeting because some people can't make it today, so I can just share it with the agenda if everyone's okay with that. Always forget to press the button at the start, so that's going out. Thanks, Serena, that's great. So to capture it for the recording, our tools are the smoking cessation wheel, Champix, and smoking daily diary.
Smoking diary, yeah. One-day
Fabulous.
smoking diary.
Yeah. Tina, can you go next and keep it to 1?
Tina Goodwin from Tasmanian Aboriginal Centre, drug and alcohol worker. And I think maybe the source of support is a really good one that I like to use. So looking at the person's slippery spaces and where they'd get their support from.
Yes, I'm hoping you talk about that today because that really captured people's attention last time. Laura?
Hi, I'm Laura from CTAC. I'm a registered nurse but currently not doing a forward-facing role. My tool, I definitely use the wheel. I mean, I use all of those tools, but the one that really stood out to me, I think Irina actually taught me, which is, can you see that? Oh, it's not very good. But the straight line with the peaks and troughs of the cravings, and I just found that really simple sort of diagram a really valuable way to explain how patches and adjunct therapy works.
Fantastic, thank you. Margaret and Jess, would you like to introduce yourselves, please?
Hi, I'm Margie Kirk. I'm a registered nurse at CTAC, and I used to be a smoker as well. I think working with people giving up smoking is really the most valuable thing, is being able to, if you can, develop that rapport with someone and just listen to them. And it has been really valuable having that nicotine replacement therapy. That's just gone another level now. I think it's great. Yeah.
Thanks, Margie. I'm Jess. I'm also a registered nurse here at CTAC. And I think probably a tool that I've used a little bit recently is just costing as well, as Irene said. I think that's a really big motivator for people at the moment, is the cost of smoking. Less probably than their health, unfortunately. But being able to just add up what they're spending, what they could be saving, it's a really nice tool.
Yes. Thank you for adjusting the camera. We can see you both now. Thanks, everyone. Jane, can you hear us okay? Thank you for joining. I know you just had some troubles connecting.
I can. Can you hear me?
I can hear you. Excellent. We're just introducing ourselves and answering that question about what's your most useful quick tool.
Okay. Are you wanting me to answer?
Yes, you're lucky last.
I'm on, am I?
Yes.
I think for us it was finance, because we are smoke free now. Finance was a fairly big motivator for everyone, and I can't say that necessarily the health status was a big factor for our young people. But also I think that, we've decreased the opportunity for smoking as well by going smoke free.
Thanks, Jane. Thanks, everyone. That gives us a little bit of a starting point for today. Zooming through procedural. Thanks, Chris. The attendance, I've captured that. Declaration of conflicts is really just there so we can manage it, but I think we all work in a similar area, so there's nothing too big to deal with there. Summary of the March meeting. Did anyone have any corrections? I did change Tina's title because she got into that role much more quickly than we expected. They're not meant to be formal minutes, more just of a summary and a capture. Yep.
All good.
Good, thank you. There were some actions in the chat group, which I did try a number of ways, and Chris's feedback was also that WhatsApp was not particularly secure, so I'll disable that. And if everyone's okay, the chat associated with this meeting is the easiest way for us to interact. So if you want to reach out to other people, they'll be opting in after they've attended a meeting. So feel free to do that.
A quick comment on that, Melissa. If it's okay, can you maybe give a go at testing that chat function between yourselves too? Because I know that some organisations have sort of policy restrictions around Teams. I know that Department of Health are a little bit strict about it, but we all should be fine here. But yeah, it's just a good idea to test it to let us know if we have any bugs with it. It should be fine, but I'll just let you know.
Yeah, thanks, Chris. That particularly after today and Tina's presentation, I'm sure people will go away and think, oh, we should ask that. And oh, Tina might know about that. So yeah. That'll be a great resource. Yeah. So Tina, over to you. Tina's going to talk to us today about what products are available for nicotine replacement therapy. And I am going to share her presentation, and you just tell me when to click through. Bear with me. I say very optimistically that this will be fine and I will be able to do it.
I am not IT, so thank you.
Melissa, I'm just going to turn my camera off because I keep losing people's voices.
Okay, sure. Now, can people see that?
Yeah.
Yes.
Yes.
Can you also see me? Can everyone see me as well?
Yes.
Perfect. That's cool because I want to do, I've got stuff on my desk as well. So, so
before you start, Tina, is that full screen or do I need to do something to?
I can see it full screen. Well, I can see it and you, which is great.
Okay, so everyone's happy with that layout?
Yeah, I'm the same. I can see it and you all up above at the top, so it's good. And Tina's a bit bigger because she's talking, so that's great.
Okay.
Yeah, I've just spotlighted Tina, so you should stay permanently there now, I think.
You're good, Chris. I was just about to do that. My support crew, fabulous. Sorry, Tina, back to you.
Great. So first couple of slides are just the intro. So everybody knows me. I'm Tina, AOD here at the TAC. For those that don't know me, I've been working here in many jobs. I'm an Aboriginal health worker, but been here for about 23 years now. So I'm almost part of the building and have just sat back into the role of drug and alcohol worker within the community. So welcome. In saying that, I've been doing quit for the TAC for about 15 years of the time that I've been here. So stepped out to practice manager new health service we opened up and have come back in. So thanks, everybody. Next slide, thanks. So I'm just going to quickly go through what the TAC does with their quit program, then talk about the quit smoking resources that we use, and then some NRT products that we use. We might do things a little bit differently, I'm not sure, but it's just what I've been adapting for our community. And I guess the most important thing is that I can do the work that I do because I have really strong connections to community. So my name is, so I'm born a Burgess, but my grandmother was a Mansell and my grandfather was a Maynard, so well known in the community and come from the islands. So I already have that trust within our community for people to share their stories and how they're feeling. So next. So the TAC has a really strong smoke-free environment policy, which oversees all of the staff at the TAC. And so it's really seen that smoking is an addictive behaviour. So we support the staff as we would any other client. So if they need to take time out to go to a quit service or a quit group, things like that, they're treated the same. So that support's really there for them. But we don't we have really strong rules around staff smoking with each other and around community. So no staff are to be smoking with community and not to be seen smoking with each other. We don't want community or work business being done while smoking. So that really supports clients and supports community not to see our workers smoking, but also supports clients to reduce and hopefully quit for their own health benefits. I'm the drug and alcohol statewide worker coordinator. So we've got quit workers in each of our services, and I support them with whatever information or support that they need. We also have the Makarapatapa program, who some of you guys would have met is Jay McDonald. So he's doing an amazing job of cold calling, one-on-one sessions, training staff, pop-up sessions. He had one here in Hobart on Friday. It was amazing. Set up in the health service and community, everybody that's coming in, and he really puts it on a day that he knows high risk clients coming in. So we had the diabetes client that clinic that day, and so he come in and talked to all of those clients that are really high risk, and then it's everybody's business. So one of the other things we talk about in our service is that it's not just the identified positions business, it's all of our staff business. And if everybody takes the time to just plant a seed or give somebody an opportunity to talk about their smoking, then that could make a change for somebody. So we have a really strong saying around it's not just our business, it's everybody's business. Next slide. So as we were talking about before, the resources that we use, and we have here we use lots of different resources. We've just had a new, I didn't put it in here, but we've just had a new counsellor that started with us, and he does hypnotherapy. So I'm thinking I've got a client that might take him up and see what that's like. So he's spoken to me and would like to see if that could be an option for him. But for me, it's really about looking at the client, and not everybody's journey is the same. So what might be good for me to quit and then for Irina to quit are totally different, and that's okay. But it's sorting out what that client needs and for their journey. So as you can see, we have the quit wheels for the costing. I talk about that a bit, but usually cost and health, as you have all said, cost is a little bit, but sometimes for whatever reason, our community can go without so much and still be able to buy smokes. And so they will still find the money no matter what, even when you're saying how expensive it is. So that is really hard, but it is a really important thing to bring up. We have the Alan Carr Stop Smoking book, but we also have that on CD, and which we've got here. And so they can take the book away, or we can purchase the book for them, or we have it on a CD that they can play in their car. I'm sure that you could download that now and have it as well, because that was back in the day. And then we also have a lot of information from Quit Tasmania. As you can see, there's the 10 ways to deal with smoking and the triggers around that, or the stop smoking and what happens. I was talking to somebody even over the weekend, and he hadn't had any smoke since I think it was Saturday, and I kept saying to him, you know, you've got no nicotine in your body now. It's been a few days later, and this is what's happening for you. So understanding that what he's actually feeling now isn't it's not the nicotine in his body, it's more like the cravings and the habit and stuff like that. So talking that through is really important as well. Next slide. So these are probably the three most popular ways that I support clients to quit. The source of support. So I couldn't find the one that because Carla was sitting in my space before me, and I couldn't find the original. So, but I knew exactly what it said. So the sources of support is that circle. So you would put the client's name in the middle bit that says you. So you're talking to the client, that's you. And so then you would look at your family or friends at home and your work or school. So up in the top corner on my right-hand side, I've got a dot for a smoker, a circle for a non-smoker or oval, and an X for an ex-smoker. So for me, I would go, I'm a non-smoker. So I would have a circle for me at home, and my husband is an ex-smoker. So I'd have an X for him. At friends and family, I would have, like, out of all my children, I'd have mostly all non-smokers, a couple of ex-smokers, and one smoker. And then at work, it would be, you know, mostly non-smokers, a couple of smokers. And so I would look at that will then and then go, okay, where's the space that I'm going to be safe and not struggle as much because I'm not going to have somebody smoking around me. And then that would be the place that I'd source my support. But we'd also talk about where's the slippery spaces, where are the spaces that are going to be really hard for me. When I go to work, everybody at work smokes, or when I'm with my family and friends, they all smoke. And so we really talk about the situations. Like, you can't say to them, well, don't go to work, because that's not realistic. Or, you know, don't ever see your family and friends again because they're smokers. That's not realistic. So we'll talk about the sorts of things. It might be, oh, well, I'm at work, I'll take a different lunchtime than I normally would go out and have smokes with my other work colleagues. I'll have a lunch later. Or I'll have those hard conversations with my staff, or sorry, with my work colleagues, and say, look, I'm quitting and I'd really like your support. So don't smoke around me. Or if I ask you for one, please don't give me one. And, so you would have those conversations. So it really gets a person to identify in their life and in their social spaces what's happening for them, and really start to prepare a bit of a plan. So that's really good. So we talk about those sorts of things, and then we start to implement some of the supportive things that we can put in place, as well as some of the things that, well, at home's a really good space. So I'm going to quit when I go on holidays, because that's going to be the time that's really going to benefit me, because I'll be at home when no one smokes. It's not going to be good to start on a Monday when I'm, away on shift somewhere and working with so it's about timing as well. So we would talk about all those things. And then the lower little section is really to get an understanding of what supports I would give a client around their addictiveness. So I would look at, I would say to them, out of 100%, what do you feel like your percentage of being chemically addicted? Like, I can't go without a cigarette. I've got to have one every half an hour. Or, oh, look, I'm, either. I don't really mind. I can go a day without smoking, but as soon as I have a few drinks, then that's when I'm going to smoke. Or when a certain person comes around, or I go and use my phone and ring a friend, that's when I'll smoke. Or when I'm really stressed. And so out of 100%, we would put in, chemically. If I was thinking about my brother, I would go, oh, he's probably 80% chemically addicted, and his habit would probably be, 10, and his social 10. So when I was looking at a quit support for him, we would definitely need NRT products. So we would need a few NRT products to be at 80% chemically addicted. And then we talk about some of the habits and the social things, like, what are the friends that he's doing, or every time he eats tea and finishes tea, or things like that. So the risk areas, just really to identify for that client what products or things. If I had a young person come in that was like 15, 16, and was like just smoking in their lunch break and things like that, I wouldn't probably put them on an NRT product. I would probably go, okay, you're not really chemically addicted, but let's really look at your social behaviours and start to put in some practices around that. So between those two supports there, I can get a really clear picture of the journey that this client might need. So once we've discussed those sorts of things, as somebody else said, we have a quit diary here that's around the same. So it does, I don't know if you can see, so it's really good. It has lots of information, but exactly what Irina said about, it'll have a part where you can write down the time, how you felt about that cigarette. So last week I was talking to a client, and I was saying, oh, so you want me to write in this? And I said, yeah, but I just don't want you to say I had 10 today. What I want you to write in the book is the one after lunch I loved it. I can't go without it. But the one that I had just after that one, really out of 10 didn't really do much for me. I could go without it. And so then we talked about, so if you had some lozenges, that would be a time that you could have a lozenge instead of having that cigarette. Oh, I get you. So save you really, once you've done a week of this, you can then start to identify what are the ones that really mean something to me, and what are the ones that I could just easily go without. So then we start to eliminate the ones that mean nothing. we leave those really important ones, you know, the first one of a morning, the last one of a night, the one after tea. We leave those till the very end, and then we just start to reduce and reduce and reduce until we get to a place where we can go, okay, we're down to 2 cigarettes a day, and then we're going to start to eliminate those. So the book's really good. There's lots of tips through it. Back on country stuff, so it's really identified for Aboriginal people. So it's yeah, lots of different community stories, and it actually has little faces. I don't know if you can see that, where you know, good, smiling, happy, all those sorts of things. So they're a great tool that we also use. And then we also have the Smokalizer. So the Smokalizer then is just a bonus. So it gives a client an opportunity to try and reduce their number. So it's visual, and it really supports when they're doing a really good job. So I've had a really great job today, and I blew a 13, and now I'm only blowing a 2, so that they love it. Although last week I did have a young person who was smoking and always had a really high number on this, and has now gone to vaping, and, you know, blew a 2 on this, and was really proud of herself even though she's vaping. So my language and discussion around that's having to change, but it is a great tool, and I'd be lost without it. Next. So once I've got all of that information about where somebody is, you know, how long they've been smoking, I do have, so on our Communicare system, we have, which I didn't put up, but we have a, on the Communicare, so we find out all their history and things like that. So I've got a paper copy of that if anybody ever wanted to have a look at it, but that gathers all that information. Sorry. I just have to Communicare passwords just come up. So we've gathered all that information, and so then we can look at sort of what we would support the client with. So you were right, Chris. Zyapans, Champix is still around, and Zyban. So Zyban was first come out in America for an anti, you know, what is it? I'm thinking about depression, antidepressant medication, and one of the side effects that they found from that was that people were reducing smoking, and so they were like, oh wow, this is a really great outcome. So then they adapted it and made Champix, and Champix is the tool that we use for people to quit, but some people have tried either and have different results from it. My mum, for example, quit on Zyban, and my husband quit on Champix. And one of the things that I've really found, and it might be a bit controversial, but for example, I'm sure my husband won't mind, but way back in the years, my husband was always said that he was going to quit smoking when he turned 30. And so he hit 30 and he was like, okay, I'm starting on Champix. He was motivated. He'd always knew he was going to do it. And he started on the Champix and he had great results. And I think he was quit for about 3 years and loved it. And he worked on mine, so he was in a really high risk of a lot of men that smoked. And after about 3 years, something happened. He started smoking again, to my dismay. And a few years after that, I sort of was like, as the wife, was like, you're not smoking anymore, you're quitting, this is it. You know, I'm a quit worker, you shouldn't be smoking. And pretty much forced him to quit. And he went on the Champix, had terrible results, you know, felt depressed, you know, just, it was horrible. And we had to stop the medication. And so he didn't quit. And then about a year or two after that, he was like, oh, I really need to do something. And I said, okay, do you want to have another go at Champix? And he's like, yeah, let's have another go. He wasn't motivated, but he was motivated, and he did it, and he quit for a while again. So the outcome of the story is, I really think that this medication depends on where you're at and why you're doing it. Same medication, same person, 3 different attempts, you know, really motivated, really wanted to do it, had the plan set. No, he was doing it for himself and done extremely well. I forced him the second time. It went miserably, you know, it was really bad. And the third time, yep, he did it, and he did it for a few years, and in his job again went back to smoking and ended up quitting on the lozenges. So I really believe it's that medication is there to support somebody, but it's also about why you're doing it and how you feel as a person going into it. So my message to some of the community that say, I used that and it didn't work for me, and I go, okay, where were you at in your life when that happened? What were the things that didn't work? Like, I had dreams. Well, okay, let's not use the nighttime tablet. If it was working, but you were struggling sleeping, let's remove that and just do daytime. So we can manipulate the way we use things to support the client, as long as that's working well. Next slide. Oh, so that comes on a script. So I better say that you have to go to the doctors just to get these products, and they come with a script. So the first script, you get a starters pack, which will last 4 weeks. You get half the amount for the morning, and then you start evenings after 3 days, and then you go to the full amount for a week, and then it's morning, night, morning, night. If you get the first script for 4 weeks, and then you have to go back to the doctors where they do an assessment on you to see if everything's working well, and then you get a script for another 2 months. So the course of these are 3 months. If you're working with somebody like me, an Aboriginal or a quit worker, you could get what's called an extension pack, and so that will give the client another 3 months worth. So you can actually get 6 months worth of Champix, as long as you're working with a support person that can support that. Here at the TAC, I can get the second script. So if they're working with me and they've already been to the doctors, got their first script, and then everything's going really well because they're working closely with me and I can check in on them, then I can get the next script, so that they don't have to make a doctor's appointment. We don't really want to take up doctors' times when everything's going so well. So I can pink note our doctors and say, can you do me a script for the client? Everything's going really well. There's no side effects, and they're happy to do that. So that's quite easy for the clients here, which makes it a little bit nicer. Next slide. So then on to the NRT products. So we do scripts here for our Nicobate 21 milligram patches. So for our clients, and because they're on CTG, there's zero cost for them, which supports us as well. And so the other products that we have, so all of our products are free for our clients. So we do the mist spray, the gum, and the lozenges. We do have the inhaler. I don't know how you say that. I say inhaler, but it's not something that TAC recommends. So we do have it here. Got one in front of me here, but we do it as a harm minimization. So if we had a client that was in hospital and they're a big smoker and they were needing to have an operation or something, or stay in, and they were going to rip out their IVs to go outside to have a cigarette, we would give these to a client to keep them in there. Or we would also give it to a pregnant mum to support a healthy baby, even if they weren't willing to quit. The thing that TAC and Dr. Maureen Davies, who was our medical director here, we didn't like the hand to mouth, because that's one of the hardest things to break, is that hand to mouth. And we felt that this product just supported that. And there were other ways that we could get nicotine into the body. So it's not a product that I readily give out. And when it first came out, there was a big talk in the community that, oh, well, I had a young fella come in and he worked at Woolworths, and he said, my boss won't let me go out to have a cigarette, and so can you get me an inhaler, because I want to stick it right up in me, can't stop me from having one of these while I'm packing the shelves. And that really indicated to me that, I feel like this is an easy way out. I don't really want to quit, but I just want to be able to access easier. So it's not something we use a lot of. It's really important to use the products correctly. So we talk about using patches and making sure that you swap from space to space, getting the right patch for you, and remembering that patches and different brands have different adhesives. So a lot of clients will say, I can't use that patch because I got a rash from it. And I go, that's okay. But if we use a different brand, they've got a different adhesive and it might not be so much on your skin. So it's not about well, that didn't work, so it'll never work. It's about going, okay, that didn't work for you for this time, but we can try something else. So knowing that, and that I've always been taught that it's just a gimmick, 1, 2, and 3, stages 1, 2, and 3. Do stage 1. It's just, and then the client will start to reduce more and more. So, you know, that's just a gimmick to sell things. So we really just buy your patch, get your Nicobate 21 milligram. They're the hospital grade ones, grade, and they have the fastest of the Nicobate 21 milligram of absorption. So we use those ones. Gum is great. We have a lot of clients that have false teeth, so it's not a product that they really want to try. So that gets stuck to their teeth. But it's also that a lot of people aren't using this correctly. So I will say to the client, I've used gum. Yes, I used gum. It wasn't that good. Why? Tell me it used to give me a gut ache, or it got stuck to my teeth. And okay. So why did it give you a gut ache? And they'll go, I don't know. And I go, well, tell me how you use this. Well, I just use it. It's gum. I just chewed it. And I go, well, that's wrong. It's not chewing gum. It's quit gum. It's not, you're not to chew it. So it sounds really stupid. Like it's chewing gum, but you don't chew it. You chew it a little bit, get it so it's got flavor coming out, and then you park it or rest it in the side of your mouth. It's really about absorption. So absorbing it into the lining of your mouth is the most important part. So I really had that discussion. And when I had that discussion about, well, you know what you're doing. You're really just chewing and chewing, and then it's going into your saliva, into your belly, giving your guts out now out the pooper, and that's all it's doing. And they're like, oh, that makes so much sense. Like, yeah, I get you now. Yeah. So it's not about chewing it. It's about getting it, chewing just to start it, but parking it so it absorbs into the side of your mouth, goes into your bloodstream and to the sensory gland at the front of your brain, which is where the nicotine goes to give you that good feeling of I've had nicotine. So once we get through that, people are then happy to go, oh, I'll give that another try. Exactly the same with the lozenges. They come in 2 milligrams and 4 milligrams, same as the gum, and they come in different flavors now because everyone got sick of the mint flavor. And I don't like the mint flavor. My answer to that is, but you really like dirty ashtray flavor. And they were like, oh yeah, when you say it like that, mint's not that bad. So now they come in fruit as well. So, but it's really about not over sucking it and swallowing all of that nicotine into your stomach. It's about sucking it for a little bit, sitting it or resting it, parking it into the side of your mouth or at the top of your gum, and moving it around so it's not sitting in the same space, and letting it be absorbed. So one of the other products that we use is the mist spray. So I think it's 7 seconds, the fastest way to get nicotine other than smoking into your body. 150 puffs in sprays in one. Comes in flavors. Oh no, I think this only comes in the. Oh no, I've got berry. So yes, comes in fresh mint and berry. It's a bit knick-knacky to use, and I've walked into a doctor's clinic and had this thing pulled apart to the very life of itself. So, you know, a medical director, doctor, who's done many years of training couldn't work one of these. So don't just assume that our, you know, well-educated people know how to use this. So how would some of our local community? So it's got a really child safety little click on the back. So once you get the hang of that and get it working, it works. The other thing that I will never give one of these to one of my clients without them using it in front of me. This product is strong. It's really strong. And so it makes your eyes water. It catches your breath if you don't use it properly. It can squirt in your eye and you'll be stinging. There's lots of ways you can use this wrong. And I will never let a client walk out of my room without getting them to use it in front of me. And when I do, I have a box of tissues there and a glass of water, because no one expects it to be as harsh as what it is for that first time. So then they'll all go, that was, oh, wow, that's strong. Whoa, have you got a tissue? Oh, I think I need a drink of water. Can I have a drink of water? And yeah, and it's all okay. It's okay. You're going to get the hiccups and this is going to happen. And this is why we do it. Because if they use that in the car, they're never going to use it again. So using it in front of me gives them an opportunity for me to talk them through it, say everybody else goes through this, I know exactly what you're going to do. They think I'm stupid having a glass of water there and my tissue ready, and then when they've done it, they're like, now I get ya, but they never feel like a cigarette straight away. They're like, no, I'm not going to have a cigarette right now. I'm like, no way. And so, yeah, but it has to be the right person. Great NRT product, had lots of success with it, but it's a product that I would always sit with a client and use.
Tina, can I just interrupt you there? That doesn't have the hand to mouth association that you mentioned with the inhalator?
Well, it's a one-off. So it's the same as if you went to put a piece of gum in, or if you went to put a lozenge in, you spray and then put it down. Where the inhaler to get, you know, they do this exactly like a cigarette. You hold it like a cigarette, it's got a butt on it like a cigarette, and you're inhaling. Where this is there's a quick spray and then it's put back into your handbag or back into your pocket and things like that. So yeah, a little bit different. It's not.
Thank you. Yep.
Next, I think I've covered everything in there. And we're just about finished, guys. So the next one is on top of that. Oh, can we just go back? Something that someone, so exactly what I think it was Laura from CTAC. I think it's Laura. Laura was saying about that, the line. So yes, exactly right. So when you're born as a baby, you're born and we're not addicted to nicotine. So our levels of addiction to nicotine's here, nothing. And so as a smoker smokes, they go up and it goes up and it goes up into the level. And so when a client is quitting, they have these spikes of, when I'm just like when I need a cigarette through the day. If you're somebody that needs a cigarette every 20 minutes, so you'll have a cigarette, you'll have your hit of nicotine, and then over 20 minutes it starts to decline, and then you're starting to get cravings, then you have another cigarette and you're going up and down, up and down. So I call them dual systems, but it's also, what did you say, Irina? It's
combination therapy.
Yeah, combination therapy, where we use a combination of products. So I would, for somebody who's quite addicted, use a patch, but then I might give them a spray and lozenges. And so the patch is keeping them on that. So, so you're here. I'm always looking at, but I've got too many screens here. So you're here, your addiction level is here in the middle and you're needing a hit, but your patch will keep you here throughout the day. So it'll just keep you here in a straight line. Giving you what you need in the background. So it's working away. And that's enough for some people. Some people, the patch is enough, but some people are needing that extra hit of nicotine throughout the day. So that's where these products come to hand, is that you can then go, okay, my patch is on, it's doing its stuff, but I need that hit of nicotine throughout the day. So that's where these products will come in. And I'm happy to give, sometimes this might be what I need, but a lozenge can stay in my mouth for 40 minutes while I suck away slowly on it. So it can sit there depending on my job and what I'm doing and the person that I am. So having the option to swap and change things around is perfect. It might be that the person doesn't need a patch at all and they're not smoking that much, but they might need to have 3 lozenges throughout the day. The thing that I do like about the lozenges and gum and inhaler is that you can number it. So I can say to a client, okay, you're smoking 20 cigarettes today. Tomorrow I want you to smoke 15, and 5 of them I want you to introduce 5 lozenges or 5 sprays. And so they can go, okay, well, I'll pick the ones that mean nothing to me. I'll have my patch on and they'll have my other ones and I'll be smoking, and then I'll just need that. And so then the next day we might do that for a couple of days, and then I'll go, okay, now you're only going to smoke 10 cigarettes. So take 10 cigarettes out of your pack, go to work that day, and then introduce that. The other ones I'm going to have 10 lozenges, until we got to the point that we're having more lozenges than cigarettes, and then we'll reduce the lozenges. So that's somebody that's really highly addicted, but it might be less for somebody, might be, I'm down to 5 cigarettes. Well, that's great. Tomorrow I only want you to smoke 3 and you're going to have 2 lozenges. So it's really good because you can give them a number and they can keep track of that in their diary. So there's some of the things that we would do. The next slide is so for us here at the TSC, it's really important to make sure that it's culturally appropriate. So having stuff that's owned by the Palawa community. So having, you know, stickers that are in our colours, having community faces. As you can see, we've got Andrew, who's the manager of our land management here, Andrew Sculthorpe, and his son. They were on telly for the Quit line. We've got Jay, who that's one of our podcasts. I think we've got 14, I'm not sure, 12 or 14 podcasts of community talking about their smoking and quit journeys. So people can listen to podcasts to get motivation or think that if they can do it, I can do it. And also, as you can see, me, which is really out of date, but me doing a pop-up in the health service with some community people. I did have an up-to-date photo of Jay the other day talking to community, which was absolutely fantastic. But making sure it's culturally appropriate for your own community, and especially for our community being Aboriginal, and making it specific, not so much mainland. I mean, there's great stuff out there for mainland, and we like to look at what's worked over there, but it's really important to adapt it to our community here. So it's really important to do that. And I think that's it. Have I got any? And thank you. Happy for questions.
That was fantastic. Thank you, Tina. And I think I'm speaking for the nurses on the line as well, from an allied health perspective, doing the client assessment first and finding out where you're at and what they need with your support before thinking about whether treatment's needed. And the treatment may not be NRT, it might be something else. I really liked you going through that, but then the details with each product, that was fantastic. Thank you. And little tips about how to use them. It was really, really useful. And the thing that got me was, okay, you tried that and it didn't work this time, but you have another option. Let's try that one. That's a really good, positive framework. I love that. And you'll notice that Chris has been fantastic in the chat, putting up links and things. So please make sure you make use of those. I do have a video of Jay as well, so I'll put that link up in a minute to where I did 5 or 6 videos last year. That one looks interesting, Chris. Questions for Tina? Feel free, jump in, or shall I go around the room?
I'll just jump in if I can.
Yes, go, Jane.
I concur, Melissa. That was a really interesting presentation, and having a nursing background, the fact that assessment underpins the direction or the course that you take is really great, because I think in our earlier days of smoking cessation, that's something that's probably been missed. The emphasis has been on perhaps why you smoke, but not so much the behaviours behind why you smoke, which is more involved in the assessment, if I'm getting it right. So thanks, Tina. And the products that are out there, wow. So I'm much more informed now than what I was before we started. So thanks, Tina.
All right, thanks, Jane.
Anyone else have any questions?
I just want to ask about the pamphlet you got printed, and well done on your presentation. You're doing an amazing job. Is that pamphlet available to other Aboriginal organisations, or is it your specific? And how did you get it printed? That's amazing. Looks like it's got lots of great stuff in it.
What pamphlet were you talking about?
The one you showed.
The smoking diary.
The smoking diary.
Yeah, so it's a product of the TAC.
Yeah.
We give it out. So it was actually printed in 2022. So it's part of the, I think it's through TasCOSS, isn't it, Melissa, the Makara Pakra through the Tasmania. It's so it's
community
funded,
fund?
Yeah, it's community funded program. It's so it was done in conjunction with community and yeah, it's a great resource. We did have a really old one that when I first started here that we had printed, and it was, you know, it was paper, and it did the job, but this one was actually had community input. So clients can come into the centre. They're on the front desk at the TAC and at the health service. So you can come in and clients can grab them. So they're there in the foyer. But yeah, it's great to also have this and work with a support person as well, because then you can have those conversations. Yeah. It's a great tool.
Yeah, wonderful.
Thank you. And I think Irina mentioned Quit Tas have a smoking journal as well, so that's another option. And I just remembered, Tina, you put up your assessment sheet. I have a link to that through the national body habit template. So if people are, and I think I've sent it to Laura actually, as part of her smoking cessation project. So if anyone needs a template for doing an assessment of someone's smoking status, let me know. I'm just aware of the time. We've got 2 minutes left. Were there any other questions for Tina? No, I'll take silent.
Thanks, Tina. That was great. It's good.
Yeah, it's really good. I had put on the agenda, what about e-cigarettes, but I think that's a whole other conversation. So maybe we'll go to that one for the next meeting if people are happy with that. I know there are a lot of young organisations that are particularly supporting young people. So I've got some great resources and links, and I sat in on an health promotion. Chris put me onto that actually, AGM last week, and there was a presenter from Quit Victoria, and they are about to launch a fantastic online hub. So that's maybe what we'll talk about next time. So I think we'll just finish off with what is one thing you've learnt today? And as always, Chris will post the feedback form, and I'd really appreciate it if you did that. It was really helpful last time. This feedback form has a few more questions, a bit more specific about how this community of practice may be helping your organisation. So I'd really appreciate some feedback on that. So Tina, was there something you learnt today?
I learned that I love sharing with people in the community and waiting to get feedback so that I can improve on what I do. So thank you for that.
You did a brilliant job. Thank you. Laura?
I loved the sources of support or source of support sort of framework. I think that's beautiful and simple and to the point. And the inhalator hand to mouth is not something that I considered as choosing not to provide that as NRT. So that's certainly something yeah, that I learnt today. So thank you very much. And yeah, it was a great presentation.
Thanks, Laura. Margie?
I love the presentation. It's always good to have that refresher about smoking cessation, and I love your dedication to it. It's, I mean, you would be a great person to work with. If I was giving up smoking, I would love to come and see you. And I liked what I learned was that talking about giving the person that plan about smoking, right? Tomorrow you're going to smoke so many cigarettes and use the mist or the gum. Yeah, I thought that was great. Thank you.
Thanks, Maggie. Irina?
Yeah, for me, it was really nice, Tina, to hear how you guys go about it, I guess, because here at Quit, we've got our way, and it's pretty similar in lots of ways, but you've got that really nice, again, that community thing that comes in and the sources of support and stuff. So yeah, nice for me to hear. Thank you.
Thanks, Irina. Jane?
Just thanks, Melissa, for acknowledging that the nicotine replacement therapy was something that we all needed to hear a little bit more about. And thank you, Tina. I learned a lot. And so just thank you.
Chris?
I just wanted to share that, yeah, like everyone said, I think you did a wonderful presentation. It was amazing. I really like that it illustrated the many different ways we need to consider, like resources, behaviour, thoughts, and different styles as well of wanting to stop smoking. And I could also tell you just have a wonderful rapport with people, and I'd imagine you really open up a space to meet people where they're at. So yeah, keep doing the amazing work you're doing, Tina.
Yeah, I think that's captured it beautifully. We all feel your energy, Tina, even on this forum. Yeah. So thank you, everyone. The next meeting was scheduled to be a face-to-face. No, next meeting's May, and we'll do e-cigarettes rather than workplace culture. We'll put workplace culture to the next one. On the 20th of June, we have a scheduled face-to-face towards the end of the project. I'm just hoping we can move that to the 22nd. I'll actually be, I've got something on the 20th. And thoughts about whether you want it in Campbelltown again or Hobart. Most people that have joined have been in Hobart, so I'll send a bit of, I'll mention that in the email because a few people have left now. Thank you, Chris. You are so good at this support stuff. Thank you, everyone, for attending. Tina, for a fantastic presentation and everyone's involvement. And Chris, I really appreciate your support. That makes it so much easier having you there. Thanks, everybody. Have a great week.
Thanks
everyone.
everyone.
Thanks, Melissa.
Bye.
Thanks.
Thanks, Melissa. Thank you. See you all.
Bye.
Bye.
Bye.